after COVID-19, people are really conscious about their health. They are not like blindly following doctors anymore. They want to do their own research as well, which is good. It's always good to have second medical opinions.
Okay, welcome back, everybody. I'm here with another expert series. I'm here with Roshan, who's the founder and CEO of a company based out of Thailand called Medex Ventures. Medex is a healthcare platform looking to, I guess, disrupt the health tech scene. Maybe, Roshan, you could share a little bit about yourself, your background, and how you came to founding Medex.
Thanks, Arlie. Thanks for your time. My name is Roshan Adhikari. I am the founder, CEO of Medex. And this is the first podcast I'm doing.
Yeah, it's okay.
So really thankful for the opportunity, and I love the way you handle conversations. You know, like you have a very humble smile. This is what I came to see.
Okay.
So talking about Medex, we are an integrated health tech platform with physical infrastructure that supports care delivery. It's one-stop solutions, especially for expats and travelers, for the people who are very mobile. And
it's a physical clinic and online, right? So online to offline so you're both online and offline.
Kind of, because tech alone is not enough to disrupt the healthcare industry.
Yeah.
Patients want trust, a real tech startup. So owning the patient outcomes is very important. And as such, we currently have 3 clinics in Bangkok and Chiang Mai, as well as central laboratory with hospital-grade lab equipments, especially for routine lab tests, biochemistry, immunology, biomolecular diagnostics, and so on.
Yeah.
These are like top grade.
So when you say healthcare, given it's a tech platform, even though you do have clinics, people are not coming for surgeries or anything like that. You said it's primary healthcare. Is that your main service offering? Or testing? What's the main service offering that Medex?
Very good question. Right now in the care chain, we are focusing mostly on primary.
Primary, okay.
But we want to upgrade to secondary.
And just for people, what does primary healthcare mean?
So primary healthcare is basically focused on diagnostics.
Yeah.
And then GP consultation.
So like the first step of kind of figuring out what's wrong.
Yes, and Medex, let me tell you, again, we don't do too much PR, we don't brag too much.
Yeah.
But to be honest, Medex is the king of lab tests.
Okay.
So we are the king of diagnostics. And our clinics are also focused mostly on diagnostics. We are a diagnostic clinic. When it comes to catalog, we have the largest number of biomarkers in our catalog. We have one of the biggest lab networks, so we work with lots of central labs. We already have our own lab, but we cooperate with probably more than 30, 40 other labs.
And that's to offer your customers the biggest variety. So someone comes to you, more or less, you hope you can give them whatever they want. Is that correct?
Yes, one stop. Now, after the lab testing is done, people might want to talk to doctors if anything is abnormal.
Yeah. So for example, I could come in, I could do a test, maybe something's wrong somewhere, and then after that I can then book an appointment with a Medex clinic to go see a doctor? Is that the process?
Right. And by the way, like care can come to you if you are too busy.
Okay.
So imagine like at our clinics, usually patients stay only 10 minutes. From registration to lab testing, 10 minutes. If there is doctor consultation, I don't think our patients wait more than 10 minutes as well.
Okay.
And the whole system is so efficient that the clinic is actual model for lean startup. The investment is bare minimum.
Yeah.
And even then, I think we are beating all the top GP clinics in Bangkok.
Okay. And then that's a good question. You say you're beating the other clinics, not to name any, but why would someone come to Medex instead of going, just I'm a tourist coming into Thailand, why would I go to Medex instead of going to Bumrungrad or Bangkok Hospital?
Because of our values, which is deeply ingrained in all the medical professionals. The professionals, they would feel real bad if patient has any bad experience.
Yeah.
We focus on simplicity. The healthcare needs to be transparent as well as affordable. So we offer simplicity, convenience, fast as well as efficient, and we focus on patient outcomes. So as a startup, we want velocity, and we're growing very fast. Let me tell you, like Medex started with an investment of just 8,000 baht.
Okay.
And so the traction we have,
What was the 8,000 baht for?
just to incorporate for the agency,
Okay.
as well as government fees. I think 5K
Yeah.
was for government, registration fees,
So you
and 3K
bootstrapped
for
it.
agency. Bootstrapped for more than 5 years now.
Yeah. So you started with the investment was very low, and then how did you build up from, you say the investment 8,000 baht. How did you build up your business to be where it is now? I think you're doing close to 50 million, 60 million baht in revenue annually.
Somewhere around.
Yeah.
I don't know, like if I want this, in public, but yeah. We did pretty good numbers from the very beginning.
And how did you get those? Like, obviously,
How
you need
did
customers.
how did I start?
Yeah. How
right?
did you get? How did
Yeah.
how did Medex become successful from the day?
So the thing is, like, you wanted me to introduce myself.
Yeah.
And to be honest, I don't think there is anything like CEO.
Yeah.
Anybody can say that they're a CEO.
Yeah. Okay.
Right? So it's just like business leaders, or let's say visionaries.
Yes.
And when it comes to people being visionary, let's say my focus is not on how much money I can keep in my pocket. It's about growing, delivering the value. If
Yeah.
I create the value, then money flows to me, all right? And so how I started was, if there is any gap in the healthcare industry, I went there and then utilized it through my marketing skills. And now our team is very diverse. So again, I am not a medical doctor. I went to study medicine and dropped out, came to Thailand.
So you have some basic understanding of medical, though.
Yes. So I think that the initial way, what potentially I did was, again, I don't remember very clearly right now, but I do remember like answering to questions in different kind of forums.
Yeah.
In Facebook groups, for example, if somebody's asking like, where can I find English-speaking doctors?
Yeah.
Then I would just like give them certain feedback. Now, my background is also, I think, very important because I went to Moscow to pursue a medical doctor degree, and
Yes.
I dropped out. And then I came to Thailand in 2014. So 2017, I graduated with.
What brought you to Thailand? Because actually, it's a medical hub here, right?
The thing that brought me here was a movie by the movie Beach that brought me here.
Oh,
It's
Leonardo
very interesting.
DiCaprio?
Yeah, and I'm not kidding. Just the movie, just because of the movie, Kofi Fi.
Okay.
They have like I think scenes from Krabi and Kofi Fi, and it brought me here. Okay, and the reason I stayed here, is also I think probably because Thailand is beautiful and the people are beautiful as well.
Yeah.
And I think like the friend circle, some few people.
It's a great place to live.
It is. It is.
Okay, and then so you moved here to Thailand in 2014. Then you dropped out of medical school, and then what did you do after that? How did you start your career in Thailand?
Okay, so 2016, I was in the second year at Webster in Thailand.
So you dropped out of medical school, then you re-enrolled here into another university?
Yes, it's an American university study abroad destination.
Yeah.
And by the way, I come from very poor background. So,
Yeah.
my entire education have been funded with scholarships,
Okay.
merit scholarship. And even like when I got into medical doctor program, actually like it was all funded.
Yeah.
Government scholarship from Russian Ministry of Education.
Okay.
Now, when it came to Webster, again, it's private university, and they also covered like the entire tuition. Now, so in the second year, because it's still for living expenses, I had to earn some money. So I did 3 internships almost together, together. Yeah. And the first one was Food Panda. So I was there for 2 months. I was paying in the something,
Yeah.
because I was doing lots of things. So from making landing pages for different campaigns.
On the digital side.
On digital side, yeah, making like notifications for mobile app. So if you see any notification in 2016, like for 2 months, I was the one preparing those notifications.
Okay.
Writing blog content, reviewing restaurants.
So you have a bit of a tech software development background as well.
Yeah, my expertise would be marketing. But the thing is, like, I'm more like a poet. So,
Yeah.
I think creativity. I would say I am I'm a very passionate person.
Yes.
So, my mind rushes very quickly, and I find solutions. And to be honest, if there are no problems in my life, I would die of boredom. So
Yeah.
anyway, in 2016 at Food Panda, I also did like things like sales, signing contracts with the restaurant vendors and so on. Bunch of
So you
stuff.
see, basically, you were saying about being like, there's no a CEO, right? You're basically doing everything in the business, even at a lower level in the company, right?
Yeah, when I started Medex, yes.
Yeah.
But then just 2 months of that exposure was also like very critical for me. And then I moved to Vethani Hospital.
Yeah.
So over there.
Vejthani is the hospital in Tonglor?
It's in Latfrau.
Okay.
So for 3 years, I contributed in the marketing department, taking care of the digital marketing from the very top. I was not a manager. This is my first job. Actually, I was still at Webster while doing part-time. Anyway, they accepted me, offered me the role, and for 3 years I was there. So after Vedhani, I went to Everex. It's a fintech startup, a blockchain remittance and all. Those were the products. And I was doing the entire digital marketing, let's say. Except content. So we had content and PR. That was not my part.
Okay. So when you started Medex, then you utilized. So would you say Medex started as, and the success was based off your digital marketing skills initially? So I guess Medex started. Was it a lab initially? Were you working with labs for diagnosis? How did it start? How did you get to the point of where you actually had your own clinic?
Just as a middleman initially.
So you're purely like a tech, kind of like, was a marketplace in a way?
Marketplace, but then focused on just few products and making sure that we are the best at that particular thing. Imagine like a GP clinic can't be a very generalist, like one clinic cannot be the perfect place for all kind of patients.
Yeah.
But what we try to do is try to be the best for certain kind of patients. Anybody looking for a lab test, we have to be number one.
Yeah.
All right. And now we are trying to climb that care chain from primary to secondary. And for that, of course, we are going to add things like imaging, private imaging center. We will focus on beauty, wellness, anti-aging, and that's in the plan.
So to sum it up, Medex, the vision is to be the number one in diagnosis, which that starts with the customer wanting to come to you with an issue, or they can come to you wanting to find out if they have an issue. How does a customer usually walk into your doors? Are they looking for something, or they know they have something already and they wanted to get tested?
The patients come inbound, so they find us online. They connect with the customer service, and that's how they make the booking. They can also make the booking through the platforms. By the way, we are tech company. Tech is the actual asset.
Yeah.
The biggest asset for Medex is not the clinics. The actual valuation will come from the tech. So our mobile app are live, Medex One on Android and iOS. But then we are trying to see like how we can make the app sticky. It's not like Grab, which you can everybody uses. Not everybody uses. Probably like at least 50% population of Thailand probably has Grab.
Yeah.
All right, and it's sticky because you can order food. You can.
You need it for day-to-day life.
Yes, and so we are trying to find some stickiness in the app. But then the thing is like again, being a creative person, I don't follow books. At Webster, I just bought 2 textbooks in the first semester. Studied for like probably 1 or 2 weeks and then forgot about it. I studied biology and all, and then I came to business. Right?
Yeah.
So I'm a problem solver, and it's more like romantic dream. Medex is a romantic dream for me. I'm very passionate about it. And there are reasons, personal reasons, like why I'm investing in health space. It's because, like from my background, like from where I come from.
Healthcare is not that accessible?
Not accessible, and, people are basically dying of like simple medical conditions.
And that's because they don't have access to diagnosis or access to primary care?
Of course, and they can't use mobile. So maybe they are not that literate, right? So I knew that I could create something. If I am going to invest like, let's say 3 or 4 decades in Medex alone, I'm pretty sure like this will be go to platform for all kind of medical needs. And this is what we are doing. We are doing lots of pilots. So my desire is not to win at everything, but what I'm trying to do is like, is it possible to build an ecosystem to support, to become like the starting point for any kind of medical needs. So ultimately, like after 5 years, our focus now is to bring healthcare membership.
What does a membership mean?
So with membership, you will get benefits. You will get lab credits, for example.
So you get tested for multiple different things. You have a profile, keep all your data.
Yes. So your records, your health insurance
will be digitalized.
Yes, your care navigation, or let's say care booking, let's say logistics, deliveries and all, e-commerce, everything comes in just one app. And by becoming a member, basically like you do your KYC and all, and your records are there, so it becomes just like click and get any kind of health services, primary care. But of course, we have more than 150 providers in our network. We are not just aggregating, we are integrating as well. So if anybody needs specialist care, it can be arranged the same day. We can refer you to top of the top hospitals in the same day. And speed matters a lot to us. From diagnostics to imaging to plastic surgery or mental health, everything is
That's
covered.
an interesting question. So
Yeah.
you say you focus on the diagnosis part, right, and then the GP part.
Yeah.
What happens when, say, they need a surgery or they need to go beyond the Medex realm? Say I come in, I do a test, I see a doctor, and then maybe I need a surgery or I need to go beyond
referral, yeah.
beyond Medex. How does that fit into the? Does Medex have partners? How would I then what's the next
What's
step?
the flow?
Yeah, the flow. Yeah.
So Medex has lots of hospital partners. We usually work only with highly accredited hospitals, especially JCI hospitals, for lab as well, like central labs, again ISO accredited, and also we look for other international accreditations. So that is, we are not a marketplace. Healthcare is not like grocery.
Yeah.
We are more like concierge. So we give recommendations. We make sure that
So they can choose where they. So you'd say these are the hospitals where you can go do your surgery. These are the ones we recommend.
exactly we want our patients to find the right doctor, to go to the competent facility where they are not overcharged. Just because the hospital has like very big name doesn't mean like you have to break your bank. The healthcare infrastructure in Thailand is very good. The only thing is there are certain problems with accessibility. There are certain problems in terms of language.
Yeah. And how about price? There's no standard pricing across the hospitals, right?
No, I think, for example, I come from Nepal, right? In Nepal, the government often tries to fix price for certain kind of medical services.
Yeah, because they want it to be affordable.
Yeah, for example, things like HIV medication. There is a standard price, and it must be purchased from the government hospitals. Why? Because private clinics, it's difficult for them to build business model, because the price is already fixed. Even during COVID-19, COVID test and all were by regulation. The price for COVID-19 test was already specified. Nobody could charge even 1 cent higher than the government mandated price. But again, for Medex, we don't do price competition because we are offering convenience, simplicity. I am an operator. I build systems. There are lots of systems within the organization.
Yeah. And actually, the fact that you said that you can do it in-home, I think it's very convenient for people as well, where I think a lot of the big hospitals don't offer that type of service. When you say, is there a price difference for, say, if I want to do my lab testing at home, say I arrived in Thailand, I don't want to leave my hotel room, can Medex send someone to come do the test at my house, and then also the GP can come see me afterwards in my hotel?
So there are certain limitations for lab test. If you're in Bangkok, you get the blood work done within 60 minutes. So max is 2 hours.
And that has to be done in the clinic.
Our medical technician can come to you. So there are lots of phlebotomists in the field. So it's more like a food panda or Grab.
Yeah.
So they just go, get the blood done, and deliver it to
the
the
lab. Okay.
And for GP, we do doctor on call, but that is a little bit expensive at this point. And as such, we don't, because if...
What's the difference in, say, a test? How much is a test to do at home?
Just 750 more.
50?
750.
750 more.
And by the way, we have promotion right now. So for normal lab tests, so if you are making your custom panel, like you want to add bunch of tests, and if the basket is more than 5,000 baht, then you don't have to pay anything for additional for test at home.
Ah, okay. So there's also a threshold. And then what about for a doctor to see you at home?
So again, we don't push it too much because
it's really hard to bring for a doctor, the time is more valuable.
The reason is I'm very pragmatic.
Could you do over the phone?
Yes, exactly. Because GPs can access the symptoms and then prescribe medications. If they are in critical pain or the symptoms are very bad, then better to go to emergency center, urgent care, clinics.
Especially if it's urgent, anything urgent, you're better to go to a clinic anyway because they have the facilities, everything there.
Yeah. For example, in Koh Phangan, like Phuket, there are some providers who will charge like 15,000 baht just for 10 minutes visit by a GP. So this is ridiculous. So, we don't want to engage in that kind of activities. Even for teleconsultation, there are telehealth platforms, right? Sorry if I make enemies here.
Yeah.
So with very low price, people can consult with GPs But what about actual usability of the telemedicine? It can be used for second medical opinions.
Yeah.
The top doctors, they have very busy schedule, and maybe some health platform like Medex, we do it. So you can talk to specialists based at the hospital, top doctors,
Yeah.
for second medical opinions. So if one doctor tells the patient that, okay, you have to go undergo certain surgery, then maybe you want second medical opinion if it is not urgent,
Yeah,
right?
because would I be correct, and I could be wrong, but am I correct that a lot of times, maybe not just Thailand, but the doctors will push for surgery because the hospital makes more money if someone comes in for surgery, stays overnight. They're more financially driven to perform a surgery than not to perform a surgery, for example.
This will be controversial, but
Yeah.
I think it depends upon the operators
Yeah,
who is operating the hospital. But of course, everybody in the healthcare space wants to practice the highest level of integrity.
yeah.
Um,
Well, so that you could. There's also that opinion, right, where someone could say you should operate, but you don't have to. But everyone has a different opinion, right?
I mean, this happened actually, like recently, and because we assist like diplomats as well, I take a special care for them.
Yeah.
Because of they are VIPs, right? So yeah, there was one scenario where a hospital asked to undergo surgery for appendicitis. They were literally extracting money, like it is very critical, it's very urgent. Pay the money right now, right now, right now. Otherwise,
Yeah.
there will be problem. So I get a frantic call from the
The client.
diplomat, from the embassy, and then I tell them, let's get the second medical opinion. If actually she is not, like in very serious condition,
Pain
then
or-
why?
yeah.
Then why undergo surgery, right? Next day, I referred the patient to another hospital. The doctor said it was just like bacterial infection. She took antibiotics after 2 days, fit and fine.
Yeah, but it's nothing to say that the first hospital was wrong, but maybe they just misdiagnosed it, right? Or there is that human error sometimes.
I do think like the leaders, the hospital operators, they determine the culture inside the organization.
Yeah.
If Medex grew from nothing, if we have lots of returning customers and people love us, then that means I am actually involved.
Yeah.
Like making sure that we have a very high level of medical precision, good hospitality. We listen to our patients as well. I mean, we treat patients as humans. If somebody has complaints, often I just call the patient directly. As the CEO, if I see some bad reviews, okay, what happened? Let me.
Yes, you can address the problems and you can understand where the complaint came from, so you could potentially it never happens again. Right?
Exactly. So I think like hospital operators, like they determine the level of care quality in
Yeah.
any healthcare facility.
And then I guess so. Medex is you obviously do very well in Thailand. Like right now, you're focused primarily on you say it yourself, like travelers, expat, tourist crowd, right? Do you have ambitions to go more like towards serving Thai people more widespread, or do you like to focus on for right now the travelers?
We want to do both. For Thailand, we're creating such a good product. Thailand is a medical tourism hub with very good health infrastructure. And tomorrow, Medex being number one app, just like Grab for any kind of healthcare bookings, this will be a huge asset for Thailand.
Yeah.
Now, the reason we are not currently focusing too much on Thai demographics is because the market is price sensitive. So we can't do like 20% off, 50% off. I mean, we don't do that. We don't do hard sell.
Yeah.
We focus on inbound marketing. People who
Because you don't want to discount your service, also, right?
I mean, I feel like it's very unfair that somebody paid like 5K for certain service, and then after 2 weeks, the same service is available for 2K. Like it's unfair for the, like the returning patients,
Yeah.
for the old patients. So rather than that, if you are a member, that's why membership is being introduced. If you are a member, you get flat discount, 10%,
Yeah.
only 20%, based upon like how much you are paying per month.
It's it's the standard for everybody.
Yeah, so because I mean, probably these are some of the, I'm just sharing like very confidential, like business model sort
Yeah.
of. But it's fine. It's like difficult to execute, and that is what I'm doing. And I still think like we are work in progress.
Yeah.
Like our story is not complete yet, and maybe it's just started.
No, that's very interesting. And then I guess, is there anywhere in the world that you would like to base Medex's success story behind? Have you seen anyone kind of in the US or Europe or India even that have kind of done something similar to what Medex is building?
Of course, yeah. There are, I won't take the names, but usually these are medical chains, like primary care medical chains.
Yeah.
Now, of course, you
And they have clinics that have kind of gone digital.
kind of, yeah, like similar model, okay. But the thing is, like, usually when we do startup,
Yeah.
we want to raise fund and exit as soon as possible. Now, for me, I mean, I also want investors to come, get the generational wealth, generational return.
Yeah.
But at the same time, I have more long-term approach because this is healthcare space. It's not going anywhere. There's so much opportunity for the investors. Like this should be the industry, like to jump in blindly.
Yeah.
But the problem is like most of the health tech startups, they are focusing on telemedicine, and this telemedicine alone is not enough to disrupt the healthcare market. Who are we competing with? We are competing with no one. We're just building something from scratch, like I mentioned, a romantic dream for healthcare industry.
Yeah.
And this will take time. But for investors, like if from zero, like for 5 years, like we have such a good record, traction. And I'm very surprised. I mean, in Thailand, I know like funding and all has slowed down, right? But there are only few investors, coming to us. And I'm like, by now, the VCs should be knocking our door.
Yeah.
Where are they? Are they like racist just because like of my brown skin or something like that? I don't know. Like
Yeah.
it's kind of crazy because, of course, like you do reflection, you compare, yourself with others sometime, which I don't usually do. But as a company, like Medex against other players in the market, I do think like this is a very good time for the investors to knock our doors.
Yeah.
But anyway, like going back to your last question. We definitely will pursue Thai market for sure. I mean, right now our 80 to 85%
Foreign.
patient base is international, foreigner.
Yeah.
And remaining Thai. Now
Which
we
is
want
good because there's 45 million tourists here every year, right? It's like
Exactly.
the size of a country.
Yes, I think
Well, Thailand's 70 million, and if you have 45 million, it's like it's
right now I think like out of 2,000 inbound travelers, I think we are serving one patient.
that's good.
Yeah, so probably, hopefully, like we can do better numbers later.
2 or 3 next year.
Maybe 10. Why not?
Yeah.
So yeah, we want to expand as well. By the way, the reason I'm focusing mostly on expats and travelers is because of my personal experience navigating care in Thailand. It's frustrating sometimes, and I wanted to solve it. Because I lived it. Like I want to build a system that like helps me as well and people like me.
Yeah.
But because we focus internationally, sort of. I mean, we are also present in Singapore and Nepal, and of course we have plans, aspirations to expand to, let's say, Indonesia, Australia, India.
That's a good point.
Yeah.
So you've said 2 things. One, you'd like to grow for financing, for funding, because you would like to grow. What is the next step? Like, so what can we expect? Where does Medex go next? So you have 3 clinics that are very successful. You have an online business which is driving a lot of traffic. What's the next, in the next 6 to 12 months, what are you focusing on?
On tech side, we are working on AI.
Yeah.
Medex Aeon, that's the chatbot. But again, it should not be used as a replacement for doctors.
Yeah, more of a guiding.
Especially for diagnostics, we are doing a smart report. So you just don't get the numbers, you also get a certain interpretation. So this is from tech side, the applications itself. We are now adding membership layer, which is actually the cover for the entire app. There are 6 different tracks actually. Tech is one of that. Now 5 other tracks would be, again, the clinic chain. Currently, the GP clinic only focuses on primary care. We are trying to upgrade it to polyclinic, a medical center, a day surgery center, and then second would be satellite clinics, so multiple clinics. So you don't have to come to just one location. If you are in Pattaya, you can visit our Pattaya.
Yeah, so
branches
basically,
and
once you have the Medex membership, say I'm traveling to Hua Hin or Phuket and I want to go see, there's going to be a Medex everywhere. That's your kind of vision?
Yes. Currently, we are doing flagship, but we are inviting healthcare providers, any kind of clinics, if you want to partner with us. We have this operator as a service model, a sort of franchise model we can discuss. So satellite clinics is the third track, tech, and then our own physical facilities and the satellite clinic. By the way, when it comes to physical facilities, central lab. So this is more like devices, equipments.
Yeah.
As we add more equipments, we can grow, right?
So you have more
We also
testing available.
Yes, we also have plan to do genetic lab. So the other tracks are membership, So membership is the actual product. The main product for Medex is membership.
Yeah.
It's more like alternative care financing.
And what does a membership cost you, and what do you get for that
So
membership?
we are rolling out membership from 499 baht per month.
Okay, so it's very affordable.
Yeah, but you get lab credit as well. So basically, like you can use almost equivalent amount of money in lab testing, and then you get further benefits. This is more for loyalty, for retention, because in healthcare, I think it's very difficult to retain patients
Why is it difficult to retain patients?
because you don't plan medical appointments usually. Once you feel sick, you just need to go somewhere, and based upon wherever you are, you just knock the.
Yeah, so for example, I could be sick in Rayong this weekend, and even though I went to Medex last time, maybe I'll go somewhere. If maybe I call you're busy, then I go somewhere else. Is that-
Exactly.
Okay.
Exactly.
So there's not a lot of loyalty.
Yeah,
the customer.
there's a decentralization. Like the satellite clinics and all that will solve this problem. So take physical facilities, infrastructure. Let's say, third one satellite clinics, the fourth one membership,
Yeah.
and then we have like lots of services like e-commerce. Let's say,
Yeah.
vendor marketplace, like on our Medex One application, Medex.co web platform. This is the new one, Medex.co. You can find lots of. It's like booking platform, just like Agoda for healthcare.
Yeah.
So vendors and all. Again, another track is like at-home services. So lab test at home, doctor on call, nurse at home, this kind of services. And one funny thing is like we rank very high in organic searches, like for medical services, even on ChatGPT and all. And we spend literally nothing, no efforts in SEO or anything like that. So it means like we have very high engagement, and as such, I think our patients, the expats and travelers in Bangkok, they can blindly trust us.
Yeah. Wow.
So these are the 6 tracks. Of course, telemedicine and all. I mean, we have like in the last track, it's more like bunch of services combined together. For telemedicine, of course, we are doing roughly around 20 tele per day.
Yeah.
And I mean, that's the max. So sometimes it may be lower because the returning patients also prefer like tele because
Yeah.
they don't have to commute.
Well, they already have the trust, right? So they already know the facilities, they know the doctors, so they're happy to jump on a call or do a video call or something with a doctor, right?
Yeah.
Convenient as well.
But I think like for everything there is right time, and for telemedicine, I think we need to wait for the IoT, AI.
Yeah.
Like, I hope that one day there will be a very small device that I can put in my pocket, and if I'm going to talk to a doctor, probably I could probably pinch a little bit blood. I don't know, like maybe. Like IoT device.
Yeah.
It gives the vitals to the doctor, so the doctor can
Straight
see
away.
like your heart rate, your oxygen level, everything. They can check in the monitor.
And for testing, is blood the best to get? I mean, like, there's so many different ways you can test, right? Blood, urine, like hair, saliva. Is blood the best way to test?
Yeah, I think so. Because there are things like functional testing or genetic testing. Now, these are not usually diagnostic. These are not 100% accurate. So these are used for screening. Imagine also, like not only for you, for all the audience, like when you do any lab test, check what methodology has been used. For example, during COVID-19, maybe your ATK was positive, PCR negative, maybe ATK negative, PCR positive, right?
And why is that?
Especially for infections, there are multiple methodologies. The cheap, inexpensive ones might be less reliable, whereas PCR or let's say viral load testing,
Is that why some governments would have PCR as a requirement versus ATK or something like that?
Yeah, during the COVID-19
pandemic, yeah.
lockdown, PCR was more accurate compared to ATK. So it's like there are bunch of lab methodologies, and as such, if you are health conscious, then you should actually ask, like which biomarker, which methodology. You can now simply use AI and figure out, like if you did the right lab test with right equipment, right methodology.
Yeah. So that's what Medex is offering. It's offering kind of the best in practice diagnosis to make sure that you're getting like the accurate kind of know-how and I guess data from your body to know what you need or what's wrong with you.
Exactly. Yeah.
Nice. Well, so I mean, I'm just being wary of time. We have a couple more minutes left. Is there anything you wanted to share, kind of about your insights on the health space industry and where you think it's going with technology? Do you see like the healthcare space changing more faster than it used to? And what's kind of some things you're excited about in the coming years?
Oh, I think like after COVID-19, lots of things have changed. people are finally loyal to particular health facilities or particular doctor. Family medicine, for example, is almost non-existent in Thailand, unlike the western part. Even in Singapore, the healthcare model is totally different. Like day surgery centers, the hospitals are not like hospitals, right?
Yeah.
Whereas over here, like standalone hospitals, they are like proper, I mean, I wouldn't say proper or something. I think that model, the Singapore model or the Australia model, might be actually better. And this is what we are trying to do in Thailand. Bring that model here.
Because I always say sometimes, and this is no discredit to them, like Bumrungrad and Bangkok Hospital, those kind of big, I just use their names just because they're the most well known. They kind of feel like factories. Like you go in and there's so many people and you just kind of get pushed around. There's not a lot of it's not very personable. Where you're right. When I was, I'm originally from New Zealand. I used to go to like a family care doctor, like where you go there, the doctor knows you for like 10 years. You know, they knows your mother, knows you. It's very, they kind of understand. They understand, and there's a bit more of a personal relationship. Yeah. Where in those bigger hospitals, there you feel like you're just part of the queue, right? The factory. Bro.
Yeah, I think that's why I think the product that Medex is building is very important. After COVID-19, people are really conscious about their health. They are not like blindly following doctors anymore. They want to do their own research as well, which is good. Again, don't do any self-prescription or self-treatment. Yeah. But then it's good to know, the medical things. Just the basic. Yeah. And also, it's always good to have second medical opinions. Yeah. You can't trust your life, especially if it is critical, with just one doctor. Yeah. Because in healthcare, getting consistent results is almost impossible.
Is it important to get tested regularly as well? Would you recommend?
Of course, yeah.
Because your body's constantly changing.
Yes. Maybe, you're infected with something, and maybe today it won't so, because maybe the number of the pathogens probably very low, right? Maybe after 2 weeks, now that infection shows up again. So this happens in the case of STDs. So, you had at least the patient had a risky exposure, they came to test, and it's all negative. It doesn't mean maybe after a month or two, maybe they have infection. So maybe it's better to follow up regularly. Yeah. So anyway, talking about the future for the healthcare, I strongly believe that the clinics will look very different just after 20 years or something.
You think it's going smaller, more boutique, more personable?
Exactly, boutique, yeah. I would say the clinic will look more like cafe. Yeah. So, and most probably you won't be carrying any papers.
It'll be digitalized.
Yes, and just like whatever Medex vision is. So you will be just going to...
so maybe you guys will even have coffee at your Medex clinics.
Yeah, sort of. I mean, just imagine like bank branches. Yeah. I think that's how the clinics will be. So maybe imagine that there are 4 or 5 players in the market. The hospitals will be still there.
But they have to adapt.
Adapt,
so
yes.
They have to,
yes.
So instead of saying, I'll just use it again, Bangkok Hospital, there'll be lots of little branches around versus having one key center.
Exactly. I would say because in Thailand, international funding is slowing down and so on. I would actually request BDMS to contact us right now, because I know BDMS is acquiring lots of startups as well. Yeah. But the thing is, if the board is thinking about digital transformation, or to
you're in line with what they're looking for.
Yes, because in a bureaucratic organization, in a large organization, it's very difficult to try lots of things. There is no efficiency. I mean, I hired lots of people from different startups who were working at a higher level, and I was literally, I wouldn't say any bad word, not happy. Yeah. Not happy, because in my team, I had people working for 5-7 years, together, because Medex Nepal, while I was still working in Thailand, the company was registered in Nepal, and there are people working together with me for so long. We are so passionate about what we are doing, and we have tried so many things. Any kind of failure, we are very stoic. Yeah. We just move on. Yeah.
They're not failures, they're lessons, something like that, right?
We are learning. I'm not a doctor. All right. Yeah. So as such, it's very important for me to.
You're half a doctor.
To observe.
After half a degree.
I mean, it's like saying like, like you're my half friend.
Yeah, I'm just joking. Yeah. Okay. Well, no, that's really insightful. Thank you so much for sharing all this information. And then I guess obviously Medex, I think you said you're raising capital. So if anyone's interested, you can reach out to me or reach out to Roshan, and we'll be happy to kind of give you more information on Medex as well. Thank you so much for your time today.
Thanks, Charlie. I love your smile.
Thank you.
For the audience as well, for listening to my rambling.